Well, good afternoon, everyone. Minister Hagee and Dr. Fitzgerald will once again be joining us by telephone today. So to start today's media availability, I will now turn it over to Dr. Fitzgerald for her latest update.
Thank you, Premier. Good afternoon, everyone. I'll begin today again with an update on the number of cases in our province. Since the media briefing yesterday, we have had 15 new positive cases. All of these cases are within the Eastern Health Region. The public health investigations are ongoing, and all those considered close contacts will be advised to quarantine. Our total number of cases is now 135. That's 126 in the Eastern Health Region, 3 in Central Health Region, 1 in Western Health, and 5 in Labrador-Grenville Health. 56% of cases are female, 44% male. By age, our breakdown is 11 people under the age of 20, 19 between 20 and 39, 22 between 40 and 49, 30 between 50 and 59, 25 between 60 and 69, and 28 who are 70 or above. There are now 7 people that have been admitted to hospital due to the virus. Of these patients, 2 are in intensive care. 4 people have now recovered. In total, we have tested 2,107 people. Of these individuals, 1,972 have been confirmed negative. I'd like to clarify self-isolation for those with no symptoms. In keeping with the recent federal order, we will be changing our requirements for self-isolation when you return to the province after travel. You may go outside, but only if you stay on your own property and can maintain physical distancing. Please do not drive in your vehicle. And I'd like to clarify a point about testing. We have guidance around who requires testing, and not everybody in a home may need testing. This will be determined by the public health investigation. What we need to remember is that the most important intervention that will reduce the spread of this virus is not testing. It's self-isolation and quarantine. And that's why anyone who is tested is told to self-isolate, and their close contacts are required to quarantine. This is the most effective way to reduce the spread of this virus. In addition, social distancing is very important as well. I want to speak again about community transmission. So yesterday I announced that we now have proof of community transmission within this province, and this is a significant development. Thank you to everyone doing their part for complying with the public health guidance and orders that I've issued. Your actions will make a difference. It is imperative we all do our part to protect our families and friends, our healthcare workers and other essential service providers, those with underlying medical conditions, and our senior population. The health and safety of the population must be everyone's top priority. The health system has been working tirelessly to ensure we are prepared to respond to COVID-19. But you must do your part. Help ensure your friends and loved ones understand that they must stay at home unless it is essential to go out. If they have questions, explain to them that this means only going out for groceries, medical supplies, hygiene products, and essential work. If your family or friends have questions, please refer them to our website at gov.nl.ca/COVID-19. You may also want to check it for them so you are informed and can help them, as I know there are people who may not have the technology or may not use the internet. Let's make sure we are all doing our part to help everyone understand why public health measures are even more important now that we have community transmission in our province. If you must go out, you have to maintain a physical distance of 6 feet between you and anyone else. Be sure to wash your hands well and often using soap and water or an alcohol-based hand rub. If you must go out and you are lining up outside a store, you are not practicing physical distancing. Do not mingle with your friends. The only people you should be seeing right now are those who live in your home. There is spread within our communities. We have to assume that anyone can have this virus. So just because you self-isolate for 14 days upon returning from travel, it does not mean that it's okay to now mingle with friends. Again, you must stay home if you are sick with a cold or flu-like symptoms. Under no circumstances, if you are sick with these symptoms, should you be going out to work or anywhere else. For those who may have just joined us, we have 15 new cases since yesterday's media availability. The total number of cases in the province is 135. The breakdown by health regions brings us to 126 cases in Eastern Health, 3 in Central Health, 1 in Western Health, and 5 in Labrador-Grenville Health. As of yesterday, we know that we have evidence of community transmission. We all have the responsibility to flatten the curve. Let's be the ones who, in the face of adversity, adhere to the public health measures to protect everyone's health and safety. Do your part. It will save lives. Our collective actions will have significant impact on how COVID-19 progresses in our province. Thank you.
Thank you, Dr. Fitzgerald, and good afternoon, everyone. Well, of course, the last thing we want to see is to see our numbers rising. Not unexpected. We've seen this trend across the country, but it's not what we want to see. We also today have 2 people in ICU. This is something that we did not want to see, so we extend our well wishes to those that are currently affected. And we also want to let them know that we have great staff, some of the best staff in this country, taking care of them. And we send our well wishes to those staff, and we wish everyone a safe and full recovery. We have been sending some strong messages about practicing safe physical distancing, and we have said that everyone must self-isolate upon entering Newfoundland and Labrador. Today, Dr. Fitzgerald outlined some more guidelines on what self-isolating means. Stay on your own property. So whether you're home by yourself and with family, friends, or even with your neighbors, I want you to take a minute to reflect. Reflect on your own actions. Ask yourself, do my actions today, do they demonstrate the practices that we want for Newfoundlanders and Labradorians? Do my actions today determine, because they can determine, and impact the life of those around me? Now, we do not want to be alarmists, but we have to be truthful with you. This is how serious COVID-19 is. Stay inside so the virus stays outside. COVID-19 only travels by physical interaction. So to help further understand what physical distancing is, today we are releasing an animation on our social media pages right now to provide you a visual understanding of what exactly we are asking you to do. Please take a look at it, share it with others, and put that practice in place. Now, speaking of physical distancing, we are seeing a lot of people lining up outside grocery stores, places like Walmart and Costco. Limit your trips to the store and only go if you need something that is essential food and supplies to you. Stay 6 feet apart. These are not meant to be social gatherings. Stay 6 feet apart. A lot of these stores also, they give you other options, online orders. They will allow you for quick pickup. So be responsible and take every safety measure that's available to you. This is not only for your safety, but for the essential workers that are working daily and working tirelessly on our behalf. And once again, we thank them for their efforts as they help us maintain food on our table. But we must also respect them and keep them top of mind. There's a lot of people that are questioning today about travel in Labrador. Now, yesterday, I had a call with the mayors in Labrador City and in Walbush. So I'm asking not only in Lab West, but also between Blanc-Sablon and Labrador Straits to only essential travel only. So if it's non-essential, do not travel in this area. The same guidelines as I expressed to the mayors yesterday means for those people traveling in Western Labrador, communities of Fermont in Quebec. Today we have checkpoints. Working with the province of Quebec and Newfoundland and Labrador, these checkpoints are set up to ensure that people are complying with these safety measures. Products that may seem cheaper in Quebec are not things like cigarettes and alcohol. Well, quite frankly, these are non-essential items. Please only travel for essential items. With that said, we have a lot of good people in Newfoundland and Labrador. And once again, I want to send a big shout out to all of you across Newfoundland and Labrador who are doing exactly what we're telling you to do. So thank you for following the health and safety guidelines that we've put in place. You are responsible, and your actions will save lives. We cannot reduce the risk of COVID-19 without you complying to the guidelines that we put in place. As an example of people who have been making some significant adjustments in their life, it just never ceases to amaze me how Newfoundlanders and Labradorians come together during tough times. This weekend, I saw many living room concerts while skimming through social media. So these artists would be people. They're professional musicians who make this for a living. People like Con O'Brien, Alan Doyle, and Damien Follett. Making music is how they make a living. So then there are others, people like Reggie and Abigail Snook from Arbor Breton, who last night had 3,000 viewers listening to their music. So music can be so beneficial to our overall health and well-being, certainly during stressful times. Now, all of these artists are sharing their time and their talent to brighten our spirits and provide some positivity during these tough times. So I want to extend my thanks to our artist community across the province who are lifting us up with music. And that's not the only people who are lifting our spirits. The Salvation Army, an organization that always answers the call in our communities. In Port-aux-Basques, they have teamed up with Marine Atlantic to offer our truckers, who we talked quite a bit about this week. These are the people that are bringing essential services and products into Newfoundland and Labrador. So last night in Port-aux-Basques, we saw 44 of those truckers delivered and given a homemade meal, a hot supper, as they continued on their journey. These are great examples of the definition of communities within Newfoundland and Labrador. People are coming together to help one another while keeping physical distancing, safety at the forefront. These are the stories that, well, they warm our heart during these challenging times. So let's keep it going. So while we see these acts of kindness throughout our province, at the same time, we know there is a lot of information coming your way. And I can appreciate that it can be overwhelming. We have a number of resources that are available to you, depending on your needs. So we ask everyone to visit the COVID-19 website at gov.nl.ca/COVID-19. That's where you will find the most up-to-date information. It's daily updated. Also, you will see some questions that are just frequently on your mind. There's a section there to help you and your loved ones. We also have a 811 Health Line website. There's a self-assessment tool. Take a look at it. There's some valuable information that can support you. And of course, the Canadian Red Cross. They have a helpline that's been set up to help those that are in self-isolation. These could be visitors or could be Newfoundlanders and Labradorians. We are now heading into week 3 in our province. There has been a lot of people that have been working nonstop around the clock to keep you safe. So let's continue to look out for one another. The best way, as Dr. Fitzgerald said, to do that, the best way to do it is physically stay apart. Stay home, stay 6 feet away from others. The time is now. What we do today determines that the virus dies and will not continue to grow. So let's take a hold of it, not allow it to take a hold of us. Practice safe physical distancing, 6 feet apart, no matter what you're doing on your daily activities. I will now turn it over to Dr. Hagee for a few comments.
Thank you very much, Premier. I think given what Dr. Fitzgerald and the Premier have said, it's worth pointing out that we are just at the beginning of this, even though we're now entering our 3rd week. What we do now will determine how our next 3 to 6 to 9 to 12 weeks will pan out in terms of the health and well-being of the people in this province. Single biggest comment I'm receiving is that people are still going out to stores in groups. Once upon a time, we would have a family trip on a Saturday or a Sunday, and when my girls were little, it was the thing we did, and we'd go round and we'd browse. This is not the time to be doing that. What we have to do now is realize that going out is only for essentials. So it's one member of the family, you do the week's shopping, and you observe the rules. Stores, particularly the big ones, do have a limit on numbers. Even the small stores have that now. The gas bar in Whitburn, 5 people only. Mr. T's in Gander has a superb setup with directed flow, and you stand on the marks, and you are 6 feet apart. That is an absolute minimum. It is no point in being good and staying at home if you then go and undo that when you're going out for a browse round one of your favorite large box stores. That is not going to get us anywhere at all. The staff in the stores are there because they are providing an essential service. They run a risk because they don't know who they're going to come into contact with. And we, as citizens of this province, need to respect that, recognize it, and give them a break. The virus only moves when people move. If you don't move, it cannot. Stay home, and certainly do not go out if you have any symptoms at all. Premier and Dr. Fitzgerald have referenced 811 and our self-assessment tool. I mentioned 811 yesterday, and indeed after the news of the possibility of community transmission, we went with a significant spike to calls for 811, and we now have over 200 people waiting a call back from a registered nurse. They will get a call back. Stay by your phone and answer it even though you may not recognize the number. Public health will not leave messages because of privacy concerns. One of the other things which never occurred to me was that there is a special line for the hearing and deaf community, and it is called a TTY line. If you do not have a TTY machine, you shouldn't be using this line. And by doing that, you are blocking access for people who have hearing impairment and need that service to access the same services you want. Please respect the principle that a TTY line, a hard of hearing line, is for people who are affected with hearing issues. One of the things that we've heard now is we've seen numbers of patients admitted to hospital. We have spent nearly 2.5 weeks preparing for such an eventuality. Our beds are free. We have staff to staff them, and the best care staff in the country prepared to do that. The RHAs are ready. They have plans in place, protocols in place at every acute care facility that has an emergency department. So if you do find yourself in the situation of needing care with COVID-19, every care facility in the province is prepared. In terms of long-term care and the other facilities the RHAs have responsibility for, we have put these under a form of lockdown. It has been a distressing and inconvenient time for families and for the people who live in these facilities. The facts of the case are it was done for their protection. But again, should the virus get in, there are protocols in place to manage that. We are well equipped in terms of ventilators, in terms of ICU beds. We're better equipped than a lot of major metropolitan cities because of our demographic. We've had to be self-reliant. We have more equipment on the way. We're working with our federal and national counterparts to make sure that our consumable supplies, PPE, are safeguarded. We've even brought in private entrepreneurs who actually have volunteered their expertise. These are world leaders in their fields of logistics and procurement, and they're working in the background to try and help us too. So what I would say to you again now in closing is exactly what I said yesterday. Make a bubble of protection for yourself and your family. Stay in your bubble and don't burst anyone else's bubble. The time to get this right, the time when we can make a difference is now. Do not miss that opportunity. With that, I will close and hand it back to the Premier.
Thank you, Minister Hagey, and we now turn it over to questions from the media.
For the benefit of our speakers, we have 7 reporters registered for today's call. In the essence of time, each reporter will have the opportunity to ask 2 questions and 1 follow-up. We will run through the telephone queue, so each is given an opportunity. Following this, as time permits, I will ask if there are any further questions. Operator, please proceed.
Thank you. We will now take questions from the telephone line. So please press *1 at this time if you have a question. There will be a brief pause while the participants register. We thank you for your patience. The first question from Ben Murphy, VOCM News. Please go ahead.
Mr. Haggie, just wondering if you can tell us any more about the Costco incident yesterday, or confirm that police identified and approached the person.
The information I have is that both Public Health and the Royal Newfoundland Constabulary have been engaged in this. If it turns out that there has been a breach of Dr. Fitzgerald's order, charges will be laid.
And has testing now increased in Central, Labrador-Grenville Health, and even Western Health now with the confirmed cases of community spread?
Testing is guided very much by the public health interviews and stratification of risk. So if you are identified through contact tracing by public health, they will have a conversation with you and determine your level of risk. High-risk individuals are swabbed almost immediately. Lower-risk individuals would be swabbed, and in any case, probably within 9 hours or so, depending on the time of day of the notification. So the numbers that we're testing, you've seen, have slowly increased over the course of the outbreak, and that will be a trend henceforth.
And, Premier, hearing the Canadian Armed Forces are on standby for deployment, with our infection rate being the second highest in the country, and not to be extreme, but is there any chance we see military enforcement here in the province if these rates continue to rise and people aren't self-isolating or social distancing?
Yeah, so there's certain protocols, Ben, that we would need to put in place. Typically there's, if you remember Snowmageddon, we would write the minister, and we would then request the military to come into the province. But the request would have to be specific about some activity that we would be asking them to do. So as we stand right now, there is no request for any activity that we would be writing and asking the national minister to come in with the Canadian Armed Forces. Those options are always available. They're always there to support us. But right now, that is not something. There's been no request to the Minister of National Defence.
Thank you. The next question is from Meg Roberts, CBC Newfoundland and Labrador. Please go ahead.
The 2 people in intensive care, were they considered at-risk people?
It's sorry, go ahead, Dr. Fitzgerald.
I don't have that information on those patients right now. But certainly there were people who were admitted to hospital who were in a more vulnerable risk group.
Could you describe the range of treatment a COVID patient might receive in the hospital?
So if they were to go into hospital, they may need some oxygen treatment. They may need to have some treatment with what we call bronchodilators, things to help open up their airways. They may need steroid treatment. And, of course, with more severe disease, if it's critical disease, then they may need to actually have a tube put down into their airway and hooked up to a ventilator to help them breathe. So that's the range of treatments that people may receive. I'm not an infectious disease expert, so the subtleties of those treatments, obviously, I would have to defer to those experts.
And is the province gearing up to house and treat patients outside the hospital if there is a need for more beds, if that arises?
It's an interesting question and very opportune. We have what's called a NES mini clinic, National Emergency Strategic Stockpile. One of these has actually been brought into St. John's and is available should we need to move convalescent patients who don't have COVID into a temporary space for accommodation to enable COVID patients to be put in the acute care facilities. That is there in case we need it. There is no anticipation of its need at the moment. We have somewhere of the order of 45 to 48% of our acute care beds vacant and available to anybody who might need them as a result of this pandemic.
Thank you.
Thank you. Next question, Elizabeth Whitten, all Newfoundland and Labrador. Please go ahead.
Last week, Minister Huggie mentioned that the College of Physicians and Surgeons and the College of Registered Nurses will provide emergency licenses to recent retirees. Do we have an idea of how many doctors and nurses that might sign up?
That's a very good question. The honest answer is no. Some of that would depend on the criteria those colleges choose. They may say only people who retired within the last, say, 2 years, rather than people such as myself who've been out of medicine now for nearly 6. Those decisions are based on professional standards, and I don't have any ability or any desire to alter that. From my point of view, we have certainly received volunteer offers through my office from physicians and nurses and others, such as respiratory therapists who've retired, who would be prepared to come back, and I have connected them with their appropriate licensing bodies.
Right, and as a follow-up, I know I've discussed it with you, Minister, but I know in the last few months there's been discussions about a shortage of family doctors in the province. And is this going to any way impact our ability to respond to the pandemic?
One of the things that the pandemic preparedness has done, and our agreement with the Medical Association about pandemic work and compensation, is that we now have a much broader option with the physicians we do have to move and work outside their traditional areas of specialty, as long as it's within their scope of competence. One of the things we have done, though, in terms of increasing access and protecting individuals, both caregivers, healthcare providers, and patients, is we have had a significant upswing in interest and registration for virtual care by healthcare providers, and we're now up almost to the 400 practitioner mark. So that enables some degree of flexibility and non-traditional working from home, which will increase access. So those are things we have in the pipeline at the moment.
Thank you.
Thank you. Next question, Juanita Mercer, The Telegram. Please go ahead.
Premier Ball, the Gathering Place recently told The Telegram that the need for a robust shelter system is urgent, so that people who are homeless have their needs adequately addressed in a safe place rather than on the street and with piecemeal support. I know many provinces are ramping up support, such as converting unused recreation centers. What preparations are underway in this province in terms of emergency support for our most vulnerable people?
Yeah, so we're working with the Department of Children, Seniors and Social Development, which would be the department responsible for homelessness in our province, recognizing that need potentially growing and is growing. But we're also seeing areas within food banks and for some of the most vulnerable within our society as well. So we're working with that department and working with the community leaders to get a handle on the need, where the need is, and the level of what that need would be. Certainly our objective here is to make sure that we do our part as a province, and also with the federal government, who also has been discussing measures around homelessness throughout the country as well.
Thank you. Premier Ball, another question for you. In British Columbia, the province has a temporary rent supplement for renters who have lost income related to COVID-19 but who don't qualify for existing rental assistance programs. So there it will provide $500 a month for those renters and will be paid directly to their landlords. Other than the recently announced eviction order, what other measures to support landlords and tenants are being considered here in Newfoundland and Labrador?
So right now, what we put in place last week, as you're right, would be about the eviction notice. That was the first change that we made. We have a contingency fund in place to deal with COVID-19, up to $200 million for Newfoundland and Labrador. These would be related to COVID-19. We've also put in place, measures to support tenants and others. So we're going to continue to work. There's with the department who handles this on a daily basis. So realizing that need may come right now from where I sit, I have not been aware of any major influx of requests for these services. But we recognize that as this grows and continues to go, this is, as we've all said so many times, not anticipating this. This is long-term problems that we're going to deal with in terms of rent and tenants and landlords and how we deal with homelessness. But we want to continue to work with the community and those that are negatively impacted. That was the first measure that we put in last Thursday, also with some contingency funds that we put in place as well.
Thank you, Premier. My next question is for Minister Haggie. Minister, Canadian physician Dr. Joanne Liu has fought epidemics around the world. She said Canadian hospitals should set up facilities dedicated only to COVID-19 patients. So, for example, a separate hospital within a hospital with no interchange of staff or patients between the two areas. She said trying to manage COVID-19 cases within existing structures when the number of cases gets higher can foster chaos and cross-contamination. So, Minister Haggie, you said we have this Nest mini clinic available to move patients who don't have COVID-19 so that COVID-positive patients can go in acute care beds. But what do you make of Dr. Liu's suggestion?
That's based on significant practical experience across the world, and I think really fits with the way our regional health authority facilities have worked. The COVID-19 patients that do get admitted will be, what the word is, cohorted. They'll be placed in a specific unit with specific dedicated staff with minimal interchange with the rest of the facility. As the need, if it does, arises, those units will be multiplied within the facility. And certainly none of what she has suggested is material that is new to us. I think part of her suggestion, though, around difficult clinical decisions, I have suggested really for my staff, because I forwarded that article to them, should really fall to the College of Physicians and Surgeons, for example, and the Newfoundland and Labrador Medical Association, and maybe even the Canadian Medical Association, because these are professional issues for physicians which need to be addressed, and I would assume that they have been. It's just that I think it needs to be clear that they are being addressed.
Thank you.
Thank you. Next question, Anthony Germain, CBC Television. Please go ahead.
Good afternoon. Dr. Haggie, I take your point that you made today, as you made earlier, about the percentage of beds that we have available. But given the development now that we have two patients who require ICU beds, can you tell us the number of ICU beds that we have available?
Our global number is 98. The last figure I had for bed occupancy specific to ICU is probably 48 hours old, and that was 54%. Our ventilator numbers are 156, and the last figure I have for their utilization, which was the same time as the ICU beds, were only 13% of those ventilators were in use at that point.
Thank you very much. And my next question is for Dr. Fitzgerald, and I think this is more of a communications question following from yesterday's briefing. When you're sharing information with us to the media, and by that people who are watching this briefing, you mentioned yesterday that there's an issue of confidentiality of patients, which I think most journalists respect and understand. But under these circumstances, other jurisdictions are not telling people the age of a patient, the gender of a patient, but when patients are unfortunately forced to be put on a ventilator, that information is being shared. And I'm wondering if you could just explain how you're going to balance necessary information if things get really serious and that patient confidentiality you referenced yesterday.
So we always have to take patient confidentiality into account, especially here. We're in a small province with, people know people all over the place. So we certainly have to balance the need of the public to know certain things versus the privacy of the individual, and that's something we have to do on an individual basis most of the time, and I guess that will guide our decision-making going forward.
And to get back to Dr. Haggie's, the notion of possibly having, I guess for lack of a better word, a sort of field hospital if it's necessary, other jurisdictions such as I noticed in Ottawa and some other provinces, their health authorities have been scouting out areas, and I'm wondering, have we considered, particularly here in the St. John's area, a place like, the Jack Byrne Arena, Mile 1, RE/MAX, or are we putting all of our faith into this this pop-up kind of hospital, for lack of a better term, that you mentioned?
That's a very good question, Anthony. I think what you've got to look at is a degree of flexible response. At the moment, we have, as I've referenced, significant bed availability within the acute care facilities. Recognizing that of itself might not be enough, we've already put some other, the Nest Clinic, for example, is available and ready. And I think should it look like we'd ever need to move into that to operationalize it, then the kind of embryo plans we have around using arenas and other large facilities like that would also then become much more fleshed out. But there's no point in spending a lot of time doing that work at the moment when the staff are actually being deployed on other operational issues. People in my department and through them, the CEOs, look at these on a daily risk assessment basis. And so what might be a sensible decision today in terms of not necessarily doing something about that, tomorrow might change and might be actioned. But these are measures that we've had in our back pocket at various stages of development and would need to be refreshed. But it's a stepwise progression, and we may need to run quickly or we may need to walk slowly.
Thank you.
Thank you. Once again, please press star 1 on your telephone keypad if you have a question. Next question, Jody Cook, NTV News. Please go ahead.
Good afternoon. This is a question that's quite generic. Out of anyone on the panel could answer this. 1 week ago today, we were at 9 cases, and today we're at 135. Assuming that there are projections being made, are we at a significantly faster rate of infection than what our projections might have put us at on the 29th of March? And we know where we stand nationally right now at the second highest. But is this sort of where we expected to be? Granted, we knew we were going to see more cases.
Well, I could start the discussion, I guess, when you look at and Dr. Fitzgerald can come into this. You're right, Jody. Last week, with the number of cases that you just outlined, but when you look at some of the outliers that have had a significant impact in Newfoundland and Labrador, this is around, of course, what I'm talking about are Carl's Funeral Home. So there's some outliers when you compare us just strictly to other populations. It really speaks to clustering, but it really sends a very strong message to people about social distancing, about physical distancing, staying 6 feet apart, and taking the measures that we put in place, taking those measures seriously. Now, many of the measures that we put in place would have been subsequent to what happened at Carl's Funeral Home, but it highlights one more time the importance of the measures that we put in place. So when you consider the numbers, the forecast, Dr. Fitzgerald can speak to that, but the message that I will continue to send is that when we get clustering of events that we've seen with Carl's Funeral Home, which by all measures would be the single biggest impact that we've seen on any population of any size across the country. Unfortunately, it was in our province, but it has an impact. So it once again highlights the need to strictly adhere to the measures we put in place.
Yes, I would agree with that, and certainly the fact that we have these cases that are presenting from calls it's not a bad thing that we found them. The most important thing is that we did find them because it enables us to be able to isolate those people and prevent further spread. So the fact that we have these cases and that we found these cases, while we don't necessarily like to have more cases, but it's not a bad thing that we know about them.
Okay, thank you. This is a nice tee up to my next question, and perhaps this is for the Chief Medical Officer. Can we address perhaps the shaming that has been going on around, even specific to the Calls case? We certainly see on social media so many people being critical of how many people this impacted, but you could also suggest that the stigma, and I do air quotes, that goes around this might prevent people from actually even acknowledging if they do feel like they've got symptoms or that they want to go for testing.
And that's an excellent point, and that is our balance that we always have to try to achieve. We want people to come forward, and we want people to feel safe to come forward. As Premier said, this happened at a time where we didn't have the same measures in place that we do now. So taking our experience from now and trying to apply that to something that happened nearly 2 weeks ago is a very it's fraught with problems because where we are now is very different than where we were 2 weeks ago. So nobody went out and intentionally spread this. So it would be my assumption, and I think that would be a fair thing to say, that these people didn't know that they had anything to worry about. So we certainly want to get away from shaming and blaming. We want people to feel safe to come forward if they have symptoms and if they've had exposure risk. And we think most people, if not all people, want to do the right thing and don't want to spread this virus. So I would ask that people try to consider the situation and understand that most people were not or did not feel that they were being irresponsible at the time.
Thank you.
Thank you. The next question, Meg Roberts, CBC Newfoundland and Labrador. Please go ahead.
While the RNC and Public Health is investigating with the Costco incident, what I guess is the status of the shopping facility?
My understanding is that after they have been in discussions with Public Health, contact tracing around that incident is part of the response from Public Health. My understanding is the facility is open.
Going back to the Falls cluster, do we know what the latest numbers are?
Related to the Falls
cluster?
The Falls Funeral Home?
Yes.
Dr. Fitzgerald, I don't know if you would have the latest based on the 15 that we had today.
I believe it's around the last numbers that I had, which are probably about 6 or 8 hours old now, was 99 were related to the call cluster. But I do stand to be corrected on that.
So just as a follow-up, we are still seeing transmission related to calls?
So the tests that have come back and the follow-up that's been done to date, we've seen are related to calls. What that transmission is, I'm not involved in all of the investigations that are ongoing, but certainly we are still seeing positive cases that have been connected back to calls. Not necessarily from the Falls Funeral Home itself, but are connected back to calls.
Thank you very much.
Thank you. Next question, Ben Murphy, VOCM News. Please go ahead.
Mr. Heggie, are any of the 7 hospitalized patients using a ventilator?
The numbers are so small, Ben, bearing in mind what Dr. Fitzgerald said, I'm going to flip that round and say there are no ventilators currently in use in the province on COVID-19 patients.
And, Mr. Heggie, this could go to you or Premier Ball, but just in terms of methadone patients, what should they do as they would typically go to pharmacies almost daily?
That's a very good question, and one we've been working with the opioid dependence treatment group as well as the pharmacist. We are not far off an agreement whereby we can convert those who are clinically suitable to carries. That means instead of going on a daily basis, they would go much less frequently, possibly as infrequently as once every 14 days. We're working on that. Some of that has to depend on clinical advice from the addictions team, but it's certainly something we've looked at very hard to try and minimize contact. We want people only to go out when it's essential, and if we can find a way of reducing that frequency, we're working hard to do it.
And Premier, late last week you were stressing the importance of federal help and programs created specifically for the province, saying that we must be treated differently. Do you have any update on that front of federal money for the province?
No, we're working daily with our federal colleagues on the 2 things. When you think about the impacts of COVID-19 that is having on our province, and there's a number of federal initiatives that are in place, that's available to all provinces and to all residents. We're seeing two really large groups, one for employees and then one for small and medium-sized businesses and some for larger businesses as well. And this is really in preparation as we go through the health crisis. Coming out of this, we still have the businesses prepared then, as they are the employment generators within the province, that they're still in a position to be able to respond quickly. But from the province's health, when you look at some of the borrowing that's required. Those discussions are ongoing. Everyone, every province, and through the Deputy Prime Minister, the Prime Minister himself, and the Minister of Finance, they all know the physical situation that we have in our province. And tomorrow evening there will be a meeting with our own Minister of Finance, with the Federal Minister of Finance as well.
Thank you.
Thank you. The next question from Anthony Germain at CBC Television. Please go ahead.
Oh, thank you. Yeah, I'd like to sort of get a little more explanation, not just for my own benefit, but I think for a lot of people who are watching, about what exactly is community spread, because I'm getting a lot of questions about that. And my question, I guess, to public health officer first would be, when a case pops up and your investigators conclude, look, we have no idea where this person got this, what's the next step?
So the next step in that situation would be to trace the contacts of the person who has been diagnosed with COVID-19, and we would trace all of their close contacts and ask them to quarantine and to, if any of them were symptomatic, we'd advise that they be tested for sure. So that part of it is the same regardless of how they got it. We would do an investigation to try to figure out why or where they may have contracted the virus, but sometimes we are not able to find that out. So then we have to go back to our messaging of physical distancing and be sure to stay inside and to try to stay in your bubble and not to burst anyone else's bubble and to go out only when it's essential. Those messages don't change. We all have to behave as if there is community transmission, regardless of if it's been recognized in our regional health authority or in our community. We all need to behave as if it is already here.
But when one of these cases sort of pops up out of nowhere, does it raise any questions in your mind as to the efficacy of the system that we're trying to administer right now to get the upper hand on this?
So these episodes or incidents, of community transmission are going to happen. They have happened everywhere, and with a virus such as this, it's not unexpected that we would see these types of cases. What we know is, and what we have learned about this virus so far, is that these physical distancing measures, this staying at home, this is what has made the difference. The quarantine and isolation of known cases, and contacts, that's what's made the difference to the spread of this disease. We are not going to likely be able to extinguish it as much as control it and reduce the peak of that epidemic curve, right, that we've been talking about, flattening the curve. So our public health messaging stays the same, and what we know and what we've seen in other countries and in areas where they've been able to do the social distancing or physical distancing and testing, that they have been able to flatten that curve. So those measures do work.
Thanks.
I'd like to remind reporters that we have 7 of you registered for this call, and there have been at least 3 of you who have asked multiple questions. We have one reporter from the Canadian Press, Michael Tutton, who is trying to ask a question. So if we could get Michael on the line, that would be much appreciated, operator.
Yes, certainly. He was the next. Michael Tutton, the Canadian Press, please go ahead.
Hi, Dr. Fitzgerald. The period of time that the people in ICU had the illness prior to being in ICU, do you have an approximation of that? And is this, therefore, the beginning of a likely growth curve in that ICU occupancy?
I don't have that detail of information with regard to the individual patients. What we have seen in other areas is that, generally once people have the disease for a period of time, several days to a little over a week before they start to decompensate, if indeed they do. So that's been the general progress that we've seen with this disease for the majority of people. But I don't have that level of detail on these patients.
So is it, as I asked at the beginning, then of a likely growth curve?
So what we know about this disease is that, there's about 2% of people who will develop more severe disease. So as we have more people diagnosed, we will see people who will develop more severe disease. But it's very early for us at this point, and I guess time will tell us what's going to be happening.
I think the main thing.
What is the range?
I think the main thing for us, Michael, if I could, the thing that we can do, and as Dr. and Minister Hagee has mentioned, so many times, is that, as Dr. Fitzgerald said, it's really difficult to determine, the erosion of, individuals', health who are positive with COVID-19. What we can do, however, is plan and making sure that ventilators are accessible and available for those that need it, making sure that there are rooms and beds available when they need it. And I think the Department of Health and Community Services, through the work of Minister Hagee and others, has done a real good job in making sure that, if need be, that space is available.
Dr. Hagee, how difficult is it to overcome this disease once it reaches an ICU stage and a ventilator stage?
One of the things when we talk about flattening the curve, the reason behind that is that every province and every healthcare system has a relatively fixed capacity. So by flattening the curve, what you do is you keep the new cases and the severity of cases below that level at which the system can manage. We have, as Dr. Fitzgerald says, if you look at the data in Canada, 6 to 7% of people numerically who are positive for COVID-19 end up requiring hospitalization. There is a view that these are the folk who have other comorbid medical problems, although that is not universally the case. Within that cohort that end up being admitted, there are a proportion who deteriorate to the point where they need intensive care unit support. And so you're looking at an ever-shrinking group of people. The main determinant, as far as we can tell, of whether or not you will end up with a lot of inpatients and ICU patients is the global number, the prevalence in the population itself. That number will rise more slowly and peak less high if people do what we've asked them to do. Make a bubble around yourself, stay in it, and don't burst anybody else's.
And Dr. Fitzgerald, sorry, I tried to get in a question. What is the age range, please, of the two in ICU?
I don't have that information, sorry.
Michael, do you have any further questions?
He hung up. I'm going to go to the next one.
Thank you.
You're welcome. From Juanita Mercer, The Telegram. Please go ahead.
Thank you. I suppose this question can be answered by any of you. I know that VLTs were suspended a while back. Any thoughts about suspending other forms of gambling, such as break opens and scratch tickets, in order to limit the amount of people going to convenience stores?
That's, as far as I know, that's something we would work with the Department of Finance on. It, raises a good concern, of course, around, gambling with, tickets and so on that are available, throughout the system. These are currently available, I think, at many locations in convenience stores and so on. So, if it's something that we need to do to prevent the spread of COVID-19, that's something they certainly could not be considered, I guess, essential items. So if it means we suspend that, because of physical distancing, that's something we're willing to consider. I mean, it makes just sense if that people are actually leaving their homes simply to go out for those types of tickets and so on. That would not make sense. We're asking people to stay in their own homes, only to go out for essential items.
Thank you. Dr. Fitzgerald, of the 15 new positive cases announced today, how many of those were community transmission? And now that we do have community transmission, will testing be ramped up in any way?
So those investigations are ongoing, and I don't have that information at this time. As you can imagine, these things can take a bit of time. We have to call people physically, and ask them questions about how they may have gotten this disease. So that does take some time. But testing will now, we will be doing testing as need be. And as the evidence suggests that we need to, we will. We're constantly analyzing the information that we're getting back, and if our testing, if we need to change the way that we're doing testing, we will certainly do that.
Thank you. Am I allowed another question? I'm not sure.
Go ahead.
Go ahead.
Thank you. Thanks. Dr. Fitzgerald, how do our per capita testing numbers compare to other provinces?
So at the moment, I think we certainly are in keeping where we would expect to be, given our population, and certainly we've certainly ramped up testing in the last little while, and we are keeping up with I think where we need to be at this point. Yeah.
Thank you.
We have about 3 minutes left for questions. Do we have any questions from Jody Cook, Elizabeth Whitten, or Michael Tutt?
We have Elizabeth Whitten, Newfoundland and Labrador. Please go ahead.
Countries or jurisdictions that have basically done the ideal response that you're looking towards as a model?
Elizabeth, we didn't get the first part of your question there.
Oh, I'm wondering, are there any countries or jurisdictions that you guys have seen as the ideal response to COVID-19 and that you're looking towards as a model for our own response?
I think we've looked at many countries. So we've looked at what they did in China. We've looked at what they've done in South Korea with regard to testing. And I think our, federal, provincial, territorial counterparts at that level, we're looking at that, and we'll certainly taking all of that into consideration to develop our own strategies.
Okay, that was it.
Thank you. Next question, Ben Murphy, VOCM News. Please go ahead.
Premier, just back to Costco for a moment. Why is Costco open? I mean, just why take the chance at all with that incident yesterday?
Well, my understanding, outlets like Costco, obviously, are also a big supplier of food for people. And so it's some essential services there. I think there's some pharmacies within Costco as well. So gasoline, at Costco as well. So primarily the reason why it is open is simply around there's some essential services and products that would be available to outlets such as Costco.
Okay, and for Minister Haggie or Dr. Fitzgerald, concerns with places like law offices staying open despite these court closures, workers there on a daily basis doing things like property titles and still having in-person meetings, albeit by appointment. Is this considered essential?
It's a good question. What we have said in the past is that as long as they can practice social distancing, there is no indication that they constitute a public health hazard. We have made it clear through direct and indirect communications with such entities that they need to obey the instructions provided by Dr. Fitzgerald. Should there come a time where the evidence suggests that we need to do differently, we'd be happy to revisit it.
And Minister Haggie, just lastly, hearing concerns from some chemo patients saying normally they're driven to their appointments if needed. However, drivers are no longer doing that throughout this pandemic. Can you speak to that and how patients are supposed to get to their appointments?
If any patient experiences challenge with chemotherapy, particularly, there are cancer navigators in each regional health authority.
Welcome to 1111. I'm Roberta Hewitt, and today I'm talking with Dominique Hurley, a truly gifted, intuitive, visionary artist. Here's that interview. You are actually very involved in many different spiritual things, and one of the things that came up was that you're a light worker, and I'm just wondering if you could share with us what being a light worker means to you.
Sure, yes. I'm sure there's a whole bunch of definitions out there. The reason I call myself a light worker is that I see my role in living basically to connect and to align to who I am, to my light within me, to Spirit's light within me, whatever